I had a little baby who had terrible eczema. And we finally figured out a good regimen, got this baby's eczema under control. And I remember the mom telling me, this is the very first time I've ever seen my baby smile. So to be able to give that to not only the mom, but the baby, right, who's feeling better enough to do that, is just something I love about my specialty. So as allergists, we get to deal with allergy problems and immunology problems both. And so from the allergy side of things, we think of common things like food allergies, environmental allergies, or pet allergies, so things like hay fever, medication allergies. So we deal with patients who have eczema. Asthma is typically due to allergic inflammation in the lungs, and so we can deal with asthma as well. People who have chronic hives are kind of the big ones from the allergy side of things. But then from the immunology side, we deal more with immune deficiency, so people who their immune system isn't working the way it's supposed to. We know patients who are suffering from bad allergies, they're not sleeping as well, they have increased daytime sleepiness, they're not able to focus as much during their daytime tasks. One of the biggest things I pride myself on in how I practice medicine is something called shared decision making. And so really what shared decision making means is you and I, you as the patient, me as the physician, will sit down and we'll talk about treatment options. So every patient who comes into our office, they have their own values. And so I find it's best to work with people to find out what avenues for treating their disease will fit best with their values, rather than just saying, this is the one thing that we should do. One of the things that hits home a lot is there are so many things we can do to treat allergic diseases. And so I unfortunately have been in scenarios where I see people who have had hives for 2, 3, 5, or 10 years. They're miserable for that entire time just because they don't think there's anyone out there who can help them. And then they find us as allergy physicians, and we're able to restore that quality of life to them. One of the things I love about my specialty is seeing patients from little babies all the way to being, end of life, really. As a parent, it seems to be one of the highest forms of praise to have a parent bring their child to see you and give that trust to you of like, take care of my child. So right now I have 2 little ones at home, a 3 and a 5-year-old. So a lot of my time outside of work is spent with my family, running our children around, spending time with my wife. But really a big one is just at this point with young kids who are growing, just really spending most of that time at home with my family.